Melissa. I just graduated from Sacramento State in the nursing program, and I'm now a registered nurse. I have always been interested in nursing because I love caring for the entire person. I worked for a few years doing my prerequisites here at Sacramento State, and once I got into the program I realized that this is definitely where I wanted to be, and I'm really happy I made that decision. Next month I'll be starting my first nursing job at UCSF Benioff Children's Hospital, which I'm really excited about. I've always known I wanted to work in pediatrics. It's worth it. It's definitely one of the most difficult things I've ever done. You think it's really hard to get into the program, and you realize it's even more difficult to get out of the program. But I don't regret any part of it. I'm so glad that I went into it, and if it's something you really want, you will get there. Yeah, I probably studied about 30 hours a week for chemistry alone because I knew that was going to be a really hard class. And that's why I took it during my freshman year when I wasn't working, because I knew once I started working it would be harder for me to commit the time to that difficulty of a class. But when I was on campus, I was studying. When I got to school early, I studied. I went to office hours. After class, I studied. I went to bed. I woke up early. I studied. It took up my life. I would sometimes get calls from my sister or my family, and they say, "Hey, it's been 3 days since we've talked." And I'll say, "Really?" It has. And sometimes it's really consuming for sure, and you have to be able to commit to something like that. I took a couple prerequisites over the summer that were a little bit lighter. I took psych, and then I also took English. Some people have had success taking sciences over the summer. It's definitely a gamble because they're one of the heavier weighted prerequisites, 5 or 4 units, and it's accelerated, so you definitely take a risk. So you want to commit, make sure you're not doing anything else at all that summer. You're not working, or anything like that. It's you and that class. My number one thing I would say is to stay together. I know it's very competitive in pre-nursing, but it's one of the most critical times to have support. One of the nursing organizations, the California Nursing Student Association, has pre-nursing panels every Friday, or the first Friday of every month, just for pre-nursing students to come and ask questions and ask for support. So they really want to be there to mentor you, but a lot of people don't know about it because it's off campus. I really got a lot of help from office hours from my faculty doing my prerequisites. They had the chem lab help hours. I did study groups for every single one of my prerequisites, and that's what really helped me succeed, was working together. Oh, and park. Park is good too. Yeah. Yeah, there are some things that you'll be exposed to when you're in nursing. Some people say, I can't do blood, I can't do this, I can't do that. One of the recommendations I would have for a student who's considering nursing is to volunteer. Because a lot of people will think they want to be a nurse, and then once they set foot in the hospital, they say, wait, I have to do what? With what? And they don't really think too much about it. And personally, I had a hard time with bodily fluids growing up too. I used to pass out at blood drives, but a lot of it is exposure time, and I definitely got used to it, and nurses reassured me when I volunteered, you'll get used to it, it'll get better. But it is something to consider when you are caring for the whole person. It's every fluid, it's every emotion, it's every family member, it's everything as a unit. If it didn't work out in nursing, I probably would have gone into our PTA, because a lot of the prerequisites are very similar. But when you hear nursing, or when you hear helping people, that doesn't mean that nursing is your only option. Some people want to help people and can't stand science, and nursing is a science degree. It was a lot of time. A lot of people, it's really easy to neglect yourself when you're in the nursing program because you're so focused on everything that you have to get done that day. They don't lie when they tell you it takes 6 hours to do your patient care plan for the next day on your patient. And making time for yourself was really a struggle for me and a lot of other people, because you're doing 12-hour shifts. Sometimes you're doing multiple 12-hour shifts in a row. You're getting up early to go to class. You're also doing your papers, your online modules, and you're also studying for your big exams that you need to have a certain level to pass the class as well. So it's a lot to think about at all at one time. There's some aspects that people don't really consider either. Is you start out with the beginning of life. You do labor and delivery. You can see the birth of babies, but you also see the end of life as well. And a lot of people aren't prepared for that, and I wasn't prepared for that on my first day of nursing school. My patient that I was caring for was being put on palliative care, and he was going to die within a matter of days, and there was nothing else that we could do for him. So that was really hard to see, first coming in. It's my first day, I'm pumped up, and my patient's dying. And I've also seen my classmates talk about experiences that really hit home for them. You have to learn to check yourself at the door before you walk in, because you're caring for this patient. This is about the patient. This isn't about you. And you have to be able to emotionally set yourself apart to care for this patient safely and effectively, and be able to think critically for them. Make sure they're getting the best care that they need. The reality of really being a nurse. When I first started in the nursing program, I heard a lot of my faculty and classmates talking about advocacy, and I really understand what that means now. Because when you're in the hospital and you are looking at everything that your patient needs, if you aren't reporting it, if you're not the one who's advocating for your patient, they're not going to get the care that they deserve and that they need. And when I was actually in an interview, one of the members told me, "You are the guardian of this child. You are the person who's going to be solely responsible for this child." And that, to me, it was something that made me excited. I was the person who was going to care for them and make sure that they had everything that they could need to have a safe recovery and to go home to their families. One of my difficult situations is that I had that reminded me I had to keep everything at the door was sometimes you have children that come in and their parents had been abusing them. And sometimes you're going to come in and you're going to see that there's a lot of stigma. There's a lot of stigma with mental health. There's a lot of stigma with drug using. So you really have to make sure that you are non-judgmental. You're caring for that person and the needs at that time. And no matter who they are, if there's someone who's a prisoner, if they're coming in, you are caring for that patient. My favorite thing about the program was the opportunities that we had in different hospitals. Sacramento has so many different hospitals like Sutter, Kaiser, Shriners, UC Davis, where we were able to have rotations that a lot of other nursing programs may or may not get to have. For example, I was going into the burn unit, I was going into the neuro ICU, and we were able to see what we were interested in and what we would want to pursue as a new grad nurse. And that was where I reaffirmed my passion for going into pediatric nursing. So I was really happy about that. I think what I like to say is you'll get there. If it's something that you really, really know that you want in your heart, you will get there. There have been a lot of times where people, like my friends, had doubted, like, am I even going to pass this class? Am I even going to get there? Has all this blood, sweat, and tears been worth it? But once I got that registered nurse behind my name, it was definitely worth it. And now I'm getting my dream job and everything that I'd ever wanted. Yes. Oh my gosh. So hard. It's worth it.